I do this work because I believe everyone deserves excellent care, regardless of where they're coming from.
I would say that the biggest misconception is that we're bad people trying to get good. It's more like we're sick people trying to get well and we need help.
What I love about my work there is the satisfaction what I get when I work with marginalized, underserved clients in need.
One of the things about corrections a lot of people don't realize is that we have a really robust healthcare system within corrections.
We as healthcare providers have an obligation to provide or to give back to a client who are most in need. The collective goal of the team working within the Correctional Health Services is to provide the highest level of care that the client requires.
Everything you ever learned in another job or in nursing school comes to play here. All of it rolled into one.
Clients come in and they haven't seen a doctor for a long time. They have not seen a dentist for a long time. They might never have seen a psychiatrist or psychologist, and it's all under this roof. And it's such a team approach.
Every now and again, we get somebody who genuinely says thank you. They have that breakdown moment where they say to us, nobody has cared before. Thank you for caring. And so when you have that moment with someone, it's just like, oh, yes.
It is a great team environment. You have lots of support, lots of resources.
I think we have a real opportunity here to engage with clients, to spend the time with them, to get to know them and their medical histories, and allow them to open up to us. Sometimes it takes that relationship building before they'll open up to you about maybe some of the medical concerns that they might not have shared with another provider before. This experience has really made me understand just how important adequate access to healthcare is in the community, especially in the context of substance use and mental health. And I've become, I think, a champion for that.
I struggled with substance use issues for a number of years, so I've been in and out of custody many times. Basically, I was, ready to make a change. And when I was ready for that change, there was people there that were willing to help me along the way. I'm currently involved in the program right now. I'm actually working as a peer support worker, and now I can say, hey, this worked for me and it could work for you too.
The role of an Indigenous patient navigator is important because of many years of colonization within our country. We have a very sad history here. What we're trying to do is create an environment through attitudes and practices and procedures that is welcoming and supportive.
Community Transitional Team is a team that is established within each of the 10 correctional centers in the province. The intention behind the team or teams is really to facilitate that critical juncture, that period of time from custody when somebody's in a correctional center and transitioning into the community.
It's important for me to help them transition into society because there's so many barriers for our clients when they're in custody and trying to connect with their community supports. So we really help bridge that gap and be a part of it, walking with them every step of the way.
If you're thinking about this kind of work, drop your misconceptions. It's a fun and safe place to work.